Hello.
Hello.
Washing my hands. Hi, my name is Carla,
Hi.
and I'll be your nurse today. Today we'll do an examination on your heart and your neck vessels before the doctor comes in to see you. It'll probably take about 5 or 10 minutes. Is that okay?
Yes.
Okay, great. Can you tell me your name?
Carmen Anderson.
Thank you, Miss Anderson, and your date of birth.
12/24/80.
And can you tell me what year it is
2020.
and what today is?
Sunday.
So we have 39-year-old Carmen Anderson, who is alert and oriented times 4. We'll go ahead and begin our examination. So tell me, Miss Anderson, have you ever had heart disease,
No, ma'am.
suffered from a heart attack, stroke, or any type of heart failure?
No.
Okay, great. So to begin our examination, we'll go ahead and have the patient lie down in a supine position at a 45-degree angle. So if you don't mind, Miss Anderson, can you go ahead and lie down for me?
Mhm.
So we're going to check the JVD of the patient. Turn your head to the left. And we're making sure that there's no type of bulging or swelling. This area should be flat. Any type of bulging or swelling would indicate abnormal findings. Everything looks normal here. So we'll go ahead and have the patient sit back up. Okay, go ahead for me. So we'll go ahead and continue our examination, and we'll go ahead and palpate the carotid pulses of the patient. If you lift your head up for me,
Mhm.
right on the side of the trachea, and we're checking for a normal pulsation, 2+ bounding, which indicates normal findings of the carotid pulses. Everything feels good, and we'll go ahead and check the other side. Okay, and I also received a 2+ bounding pulsation on the other side, which also indicates normal findings. So we'll go ahead and auscultate the carotid pulses, and we do that by using the bell of a stethoscope, and make sure that's turned on. We use the bell of a stethoscope to listen to low-pitched sounds. So when we do this, Ms. Anderson, I'm going to have you take a deep breath in and out and hold, okay?
Mhm.
So deep breath in and out and hold. Okay, and we'll check the other side. Deep breath in and out and hold. Okay, great. I heard Ms. Anderson's pulse. I did not hear any type of bruise or swishings, which would indicate abnormal findings. So we'll go ahead and inspect the chest, and we're checking the pericardium of the patient, which is the covering of the heart. I don't see any type of bounding pulsations coming from her chest. I see normal respirations. So the next thing we'll do is go ahead and check the apical pulse of the patient, which is at the 5th intercostal space midclavicular line. So midclavicular line, 5th intercostal space, right below the nipple, and I'll go ahead and palpate that. Everything feels normal. So we'll go ahead and auscultate the chest. To begin our examination of auscultating the chest, we're going to start with the diaphragm of the stethoscope, so I'll make sure that that's turned on. Okay, and our first inspection will be at the aortic, the 2nd intercostal space, right next to the angle of Louis. Okay. Then next, the 2nd intercostal space, left sternum pulmonic area. And I hear the S1, S2, left dub. 3rd intercostal space, Erb's area. Okay, 5th intercostal space, left sternum. Okay, and then the 5th intercostal space, midclavicular mitral area. Okay, sorry, excuse me. Okay, great. So I did not hear any abnormal heart sounds. I did not hear any murmurs or any clicks. We'll go ahead and listen to the patient with the bell of the stethoscope to indicate the low-pitched sounds. And once again, we're going to start at the aortic, left intercostal space, next to the angle of Louis. I hear the S1, S2, left up. Second intercostal space, pulmonic, left sternum. Third intercostal space, Erb's area. Fifth intercostal space, left sternum. And then we have the fifth intercostal space, midclavicular line, mitral area. Okay. I did not hear any abnormal heart sounds, no clicks, no murmurs. Everything seems normal. Ms. Anderson, that will complete our examination. Tell me, are you having any pain before I leave?
No, ma'am.
Okay, and is there anything else I can do for you?
No.
And would you like for me to close the door when I leave?
Please.
Okay, thank you. Well, it was a pleasure to meet you, and the doctor should be in with you shortly, okay?
Thank you.
Thank you. Have a good day.
You too.